Hello, good morning all. I don't know if you can hear me. Can you hear me? If you can hear me, can you just wave your hands? Let me be sure. All right, thank you very much and welcome to today's tele-echo session. I want to ask that all the facilities, please, you can help us to turn on your video as well as send in your attendance. I see some facility that nobody is seated there, but your video is on, and some just turn the echo call and then you're not there. So that's why we ask that let your video be on. We are specific with facilities. You know, you can't just come and write CCFN FTH Gombe and you're not there. You know, so we want to ask that please turn on your video. It's very important. So today we're looking at another interesting topic on HIV stigma and discrimination. It's a trending one, especially in some rural community and even in cities here where people are being discriminated based on information available to them. So today we're going to deep dive into that. We have one of our renowned subject matter experts that will be talking to us on that. Before then, I think the Federal Ministry of Health are on a very high level meeting and may not be able to step out to give an opening remark. So on behalf of Federal Ministry of Health, you're welcome to today's tele-echo session. But then we have CDC representative who will be giving an opening, giving a goodwill message. And we have John Essien from CDC to give a goodwill message. John, please, can you unmute yourself and go on with a goodwill message? Hello, John, are you there?
Hi, Prosper, good morning. Can you hear me?
Yeah, good morning, I can hear you.
Yeah, great. Thanks a lot. Good morning, everyone. And I bring greetings from CDC leadership. Thank you for being able to join this very important session today. As we all are aware that HIV stigma, is still remains a public health concern in Nigeria, and so people living with HIV are faced not just with personal medical problems, but also with social problems associated with the disease, and that is the stigma and discriminatory attitudes. So it is one of the major barriers to testing, treatment, and uptake and adherence. So today we are, well equipped today with our subject matter expert, Dr. Yetunde, who will be taking us through these processes today. So please pay rapt attention and be ready to absorb what she has to offer today. And so I like all of us to be prepared. We're still standing by and waiting to hear what she has to download onto us today. So I'd like to say welcome and be attentive. We'll see you by the session. Thank you, Prosper.
Thank you very much, John, and thank you to all that have joined. We currently have 206 persons on the call. We ask that you kindly let all of the facilities and your folks that are yet to join. We have our renowned subject matter expert, Dr. Yetunde Akani. She's Assistant Director of Social Work and a clinical psychologist from University of Port Harcourt Teaching Hospital. She has a lot to tell us today. Dr. Yetunde, please, if you are there, can we have you mute yourself and share your screen, and let's hear you what you have for us today.
Okay, good morning, everyone.
Good morning.
For the purpose of those who have not seen my face before, but just hearing my voice, I just want you to see who I am. And then after now, I'll switch off so that I'll have a good network to do the presentation. So good morning, everybody, and you're all welcome on the call this morning. Prosper, I hope you can hear me well.
Yeah, I can hear you.
Okay, so can I share the screen?
Please go ahead.
I'm sharing now. Do you have it there?
Yeah, I have it. Email. Yes, exactly.
Okay, so good morning, everyone. And you are all welcome to another section of ECHO this morning. And like I said, or like John Essen had already given us a pre-information about what we want to talk about, talking about HIV stigma and discrimination. And for us this morning, we need to understand that it's going to be more of participant engagement, participation, because this is something that we are all aware of, and we've had encounters with our patients, whether in the facility or in the community. And so it's about sharing experiences and ideas, and for us to be able to develop strategies that can actually help us to get through at this. So at the end of this presentation, it is expected that we all understand what stigma and discrimination is in HIV and AIDS, and then at different levels, because stigma and discrimination varies in age, in the gender, and other situations. There are different manifestations of it. What is displayed as stigma and discrimination in health is different from how it is being displayed or manifested in the homes and other areas. But then there's a general manifestation of stigma that we all are aware of. Then we should be able to describe what types of stigma exist and discuss the effect of stigma. And then we should also be able to understand what the causes of stigma are, and then see whether we are part of causes of stigma that we have around HIV and AIDS. And like I said, we'll discuss what the manifestation of stigma is at different levels and identify ways of reducing it. So for us, Prosper, I think you need to understand the fact that I will need a lot of responses from participants this morning, because this is something that we all are aware of, and so we need to talk about it and see the way forward. So for the definition of stigma and discrimination, I want to hear from the audience, 1 or 2 responses, please.
Okay, that's good. Can we have can the facility please indicate by raising your hand? Okay, we'll have a PHCC Maraba. I've enabled you. Can you unmute yourself and respond?
Yeah. Hello, good morning, everyone.
You're
Hello,
welcome.
can you hear me?
We can hear you.
My name is
Sure.
Stella. Okay, my name is Stella Ebe, Maraba Gruku, PAC, IHV, and Nasrawa. I can.
We seem to have lost you, PHCC Maraba. PHCC Maraba, we can hear you again. Okay, can we have another facility indicate by raising your hands or individual on what is discrimination to your own understanding?
Start.
Stigma.
Sorry, somebody can just step in. Jesus. Oh. Hello?
Yeah, Dr. Yetunde, I can hear you.
Okay, so is there another person?
Can we have some other person to respond? We've lost Marabagu. Okay, let's have CCFN Enugu. Can you unmute yourself? Daughters of Divine Love, I guess. Can you unmute yourself?
Yeah, so this it's necessary for us to have this conversation, and that's why we have to do this, please. So, and if you are speaking, you can just give us the need of introducing yourself. Just tell us what you
Daughters of Divine Love, you've been enabled. Can you unmute yourself and respond? Hello, Daughters of Divine Love. Your hand is up and you've been enabled to speak.
So Prosper, you can just look through on the call if there are other persons.
Yeah, I am looking on the call.
Okay, so
are there other persons that want to respond? Daughters of Divine Love, I have enabled you. You can unmute yourself and speak. Okay, we also have Uhiri Sarah. I've enabled you. Can you speak now? Oh my God, what is happening to people's network today? Dr. Yetunde, are you able to
Okay.
hear me? Can you hear me? Dr.
I'm hearing you very well. You're
Okay.
very audible.
Okay, so Daughters of Divine Love, I have unmuted. Okay, they have dropped that their hand. Okay, can we have someone else just briefly explain what you understand by discrimination
And stigma.
and stigma? Okay, APIN or your state. So APIN or your state, can you speak? I have enabled you.
Okay, good morning.
Good morning.
Good morning, sir. Yes, sir. Discrimination is a kind of prejudicial treatment of different category of people, especially on the ground of, let's say, because someone is HIV positive and people are separating things from her, and because of the ethnicity of the person, or maybe the age, the sex of the person, or maybe because the person has one disability or the other, and people are kind of separating things from her or he. I don't know if you share the understanding of the difference between one thing or the other. Thank you.
All right, thank you very much. We still have River State Program, IHVN.
Okay.
Can we have you respond to IHVN River State Program? And then we also have CIHP Kaduna. CIHP Kaduna, can you go on? General Hospital, I think Kafanchan.
Good afternoon. Good morning, everyone. I think stigma is a way of separating oneself from others. Yes. While discrimination is when people separate themselves from one who is disabled or who is having a particular illness, such as HIV. Thank you.
All right.
Okay. So thank you very much for your wonderful contributions. It's obvious that we all have an idea of what it is, whether relating to just HIV or other areas of life where people face stigma and discrimination. But basically, we need to understand what stigma is. It refers to an attitude or thought based on an individual's perception of certain things. And so when we talk about stigma, we're talking about giving an individual a distinguishing mark or a characteristic that is seen as negative by society. It can be a mark of sign of disgrace. It can also be an attribute which is deeply discrediting. These are the things we need to know when we talk about stigma. And then for discrimination, what are we talking about? Discrimination is the act of making distinction between people based on the groups, like somebody just said. She said it could be age, classes, and other categories that is already perceived to be of disadvantage. And that's why it's good we all have a general understanding of what stigma and discrimination is before we now relate it to what it is when we talk about HIV and AIDS. So when we're talking about stigma in HIV and AIDS, what are we talking about? We're talking about the fact that that negative thoughts or labeling directed towards an individual because the person is living with the virus. And that results into feeling unwanted and being rejected. When we talk about stigma for persons living with HIV, we believe that it's only certain groups of persons that can get HIV. We make necessary moral judgment about people who take steps to even prevent their HIV status. So, but then what do we need to understand? That stigma refers to the attitude, the thoughts, while discrimination refers to the action, the act of behaving negatively or isolating an individual because of the fact that they are living with HIV. So if you look at it, discrimination can be expressed as both negative behavior or actions directed towards people who are living with HIV. It's very important for us to know that. Then we also need to understand the fact that stigma are the greatest barrier to persons living with HIV. Before we come to types of stigma, we want to talk about the effect of stigma on HIV. It's the greatest barrier to preventing further infection. It prevents adequate treatment for persons who are living with HIV. We need to understand that stigma itself is as old as the epidemic itself, which is often rooted in lack of information, limited understanding, and fear of unknown. We need to understand that it's a pervasive play because it denies persons living with HIV the right to fully participate in treatment, in social interactions, whether within the community, in workplace, anywhere they find themselves. That's the result of stigma. We also need to understand that stigma has been recognized as the third phase of the HIV epidemic. Why? Because it creates a boundary for us in managing patients. So it's important for us to really understand what stigma and discrimination is. And then we also need to realize the fact that most of these patients who are being stigmatized could have other issues of stigma that they are also facing. And so what that means for us is that some of the patients we are dealing with are having double form of stigma. We call it compounded stigma, where there are other issues that causes them to face stigma and discrimination at different levels of their lives. So for us, we need to understand the different types of stigma that exist and know the role in which we play or where we fall as healthcare professionals. So we have the public, stigmatization and discrimination. When we talk about public stigmatization and discrimination, it could also be referred to as the external form of stigma that we all know, but we want to try to break it down so that we'll have a better understanding of it all. So when we talk about the public, we're talking about external. It involves negative and discriminative attitudes, devaluation of others at different levels. Some persons face the problems of being refused at jobs or getting jobs easily. They are denied community services. They are deprived a lot of things within their communities. To some extent, some people even face the problem of housing when we talk about public stigma, because you discover that in a compound where, or even a landlord who has an idea of a client, of an individual who is living with HIV, can deny them access, especially within communities where people who are living with HIV can easily be identified. Then we have systemic, which is also known as the institutional form of stigma. Why are we saying it's systemic? It is because it involves policies that are sometimes intentionally or unintentionally limiting opportunities for persons living with HIV. If you look at what I have there, I say it reduces access to care and resources due to policies. There are certain policies of government or even private organizations that can actually limit people's access to care, whether intentionally or unintentionally. Then we'll have the self-stigma, which is internalization of stigma. So because persons living with HIV haven't faced a lot of stigma, becomes internalized, and so they start exhibiting it. And what are these forms? You see them presenting with negative attitudes. As a result of self-stigma, some persons disassociate themselves even when they are not being disassociated. Some persons isolate themselves even when they are not isolated. It's as bad as people abandoning their jobs. It's as bad as people not engaging in social activities. activities of daily living that gives them interest. And what is the root cause of this? It's basically, it's based on the understanding and the effect of external stigma that these persons have faced. Then we have the professional stigma where we fall. We call it professional stigma. For HIV and AIDS, we decided to highlight this. It's very important for us. It's a professional stigma. It occurs when healthcare professionals hold stigmatizing attitudes towards their patients. And you will all agree with me that we are guilty of this many a times. And the root cause of this too is based on fear and misunderstanding of the causes and symptoms of HIV. There are some health professionals who don't even have a business. So the professional, when we also talk about professional stigma, we also have what we call stigma by association, whereby because we are professionals providing services, what happens? You are being stigmatized because of the kind of work you do. So people connect you with the stigmatized individuals. So these are the various types of stigma that we have. And I know that if I open the call, we have other forms of stigma that people would identify. But if you look at them, they all fall in any of these 4 categories. And so it's important for us to understand what causes stigma, even at these various levels. And so, Prosper, you open the call again, and let's hear from the participants. What are the causes of stigma?
Okay, so let's hear from the participant again. Okay, we'll have PHCC Maraba Guruku. Can we have you? You've been enabled to speak. PHCC. PHCC Maraba Guruku, can you speak now? Can you give us examples of causes of stigma and discrimination? Okay, we also have Epin Ondo. Epin Ondo, you've been enabled to speak. Can you go on and speak? Epin Ondo State, you raise your hand. Can you speak, please? Unmute yourself and speak. Okay, let's have Ababa Grace. Ababa Grace, you've been enabled. Can you speak, please? Unmute yourself and speak.
Okay. Good morning, House.
Good morning.
Okay, I have here lack of understanding of the disease process and what happens with patients that are living with people that are living with HIV/AIDS. Because if you have the good understanding, there won't be an issue of stigmatization. You won't stigmatize the clients. You won't stigmatize the people living with HIV/AIDS. So that is what I feel. That lack of understanding. Yes.
Thank you.
You're
Thank
welcome.
you. Thank
You're
you.
welcome.
Yes, thank you.
Okay, let's have Epin or your state. Can you speak? We also have.
Right.
Okay.
Thank you, sir. We have ignorance and misinformation too. It also contributes to stigma, causes of stigma. And because some people have negative attitude and belief towards HIV, so all this cause stigma. Thank you.
Thank you very much. So, can we have one more person to speak?
Okay, so let's have.
So okay, Prosper, if no any other person, I think that's fine.
All right.
And so thank you very much for your contributions. Like I said at the beginning of the presentation, we're all aware of this. We just want to move around this again and see what we need to do. And so like the causes you have identified, they are very, very valid. We need to understand that the basic issue or the basic cause of stigma around HIV and AIDS had to do with fear of the disease. And this fear too, we could attribute it to the fact that that initial image of what it looks like for people to live with HIV in the 80s. That's why we said there were some institutional policies, or even the way the HIV information was communicated initially. It created so much fear in the minds of people. If you have HIV and you don't go for treatment, you will die within 2-3 years. If you do this, showing you some very wasted individuals, billboards everywhere. And that's why you see that a lot of things have changed around that area, because even the way we give out this information are quite stigmatizing. And so stigma and discrimination is rooted in misinformation, misconceptions, ignorance, negative attitude, low level of awareness and information, and then issues with religion and cultural beliefs. If you give people opportunity to tell you, and that's why during counseling, we want to ask people, what is HIV called in your place? How is someone living with HIV referred to? How are they viewed? And then you hear it. So there is a lot of cultural and religious influence when it comes to stigma and discrimination, because every individual belongs to a community, and so they will go back to the community. And then we also need to agree with ourselves that every individual, all of us as humans, we have certain things that forms our value. And so where your values are formed by cultural beliefs, religious beliefs, you find it that you find it difficult to actually accept things that are outside those things. And so that's why stigma and discrimination in HIV and AIDS, we said, is as old as the disease. But then we need to move from where we are. We need to understand that the causes of stigma can be reviewed. We have little or nothing to do about stigma and discrimination, but then we have much to do about the causes, because the causes comes from us, comes from the individual, comes from the community, comes from the organizations, comes from the government of the day. And so that's why we need to re-strategize and understand the issue of stigma and discrimination. The stigma and discrimination around us, it affects people's understanding, even accepting. It creates a lot of denial for persons living with HIV. And you agree with me that at times, that is what is actually responsible for us not arriving at some of our objectives. So when we talk about causes, inadequate information strongly leads to discrimination. That's the truth. The information at times is not adequate. The information at times is not even there. It's a different thing to be informed. It's a different thing to have it enough. And like I keep telling people, one thing we need to understand is that one of the reasons why behavior does not measure up with prevention messages, it's because of the way informations are being given. We need to understand that the lack of knowledge about HIV education and treatment also increases stigma and discrimination, whether on the part of the individual that is infected or on the part of the person providing services or even providing support. There are a lot of myths and misconceptions about HIV that it's yet to be corrected, that is yet to be demystified among the populace. And so we need to do a lot in that area. We need to understand that ignorance, we have seen it. You could see it's a vicious circle. It moves around. Because people are not informed, because people are keeping quiet, they live in denial. Why are they living in denial? Because of what is perceived of them as being persons living with HIV. Because of fear of the unknown, it results to stigma. And so, like we said, stigma is the attitude, your thoughts. And then you need to what? Put it into practice. And that brings about discrimination and behavior. And so when there is discrimination, there is silence. So it's a vicious cycle, it moves round. And so these are things we need to really realize about the causes and determinants of stigma. Then, what then are the effects of stigma for us? What are the effects of stigma? Well, we all agree with the fact that the basic cause of stigma is lack of information, low level understanding, inability to build skills around information giving. Those are basic things that actually cause stigma for us in HIV and AIDS. So what are the effects of stigma? Prosper.
Yes, I'm here. So let's get back to the core effect of stigma. What are the possible effects of stigma? Can we have you indicate by raising hand if you have, okay, we'll have Falana Oluwa Kemi. Falana Oluwa Kemi, can we
Hello,
have you
sir.
speak? Yeah,
Good
please
morning,
go on.
sir.
Good morning.
So the effect of stigma always leads to death because the viral load, the person using ART will not suppress because doesn't have the knowledge of the drug, even something that is happening to her, doesn't have or him, doesn't have the knowledge of it, and it leads to death, early death.
All right. Thank you very much. We have other ones. By the way, we have one of our CDC person, Dr. Bukola Adewumi, Prevention Branch, who will be speaking with us and maybe provide further perspective after the presentation. I hope Dr. Bukola is still here. Yeah. So can we have
Yes, I am.
Oh, okay. Okay, good.
Thank you.
We have Obafemi Awolowo University Teaching Hospital enabling you to speak. Can you please unmute yourself and speak? Obafemi Awolowo University Teaching Hospital. Okay, if you are not there, can we have Ababa? Okay. Can you go on, please?
Yeah, the effect of stigma on people living with HIV. This does not allow people to take their drugs or coming for treatments. Then it even reduces the number of people that are ready to even carry out the test to know their status. Because once they know their status, they believe that people will stigmatize them, and this will have negative effect on them. So most of people are not even ready to participate in testing for HIV to know their status. So that is my own contribution. Thank you.
All right, thank you. Let's have
Okay, so thank you very much.
Let's have final one. AQ Speed Program, Osun State. I think it's still Obafemi Awolowo University Hospital. AQ, please, can we have you?
Yes, all right. Thank you very much for the opportunity to speak. Like my colleague has said earlier, the effects of stigma would be that our clients, the PLHIVs, would really not want to come around to the facility for their drug pickup or to receive viral load sampling. And this will culminate in the fact that they will not be unsuppressed and furthermore encourage the transmission of the virus. So those are possible effects of the stigma. Thank you.
Okay, so yeah, thank you very much for your contributions. And it's good that we're all on the same level. And so now we've seen what the effects are. And this is because we're attuned to this, we are used to it, we've been saying it. Because of stigma, like you all said, there is treatment interruption, there is non-adherence, there is denial. We have people who are reluctant to seek for help when it's necessary. So we need to understand that the impact of stigma is so great on patients that some of them have described stigma itself as almost as bad as the virus that they have. That's the truth. And we need to understand the fact that stigma and discrimination can contribute to the worsening symptoms and reduce the likelihood of getting treatment. I was happy with those who talked about viral load. We all know that If a patient's viral load becomes undetectable, then the risk of transmission is much, much lower, or if possible, even zero to some extent. And that's why we said we have treatment as prevention now. So the effect is so enormous that it can never be overlooked. It reduces the hope of some of these persons. It brings about low self-esteem. We need to understand that. Some persons, as a result of the stigma they face, they could even develop some mental health issues. As a result of stigma, people do not want to associate with others. They find it difficult to have social relationship. Then we've talked about non-adherence. People find it difficult to work. If you have opportunity to talk to people, especially when you have patients who are not adhering to treatment. For me, my encounter with my patient, most times, for those who do not adhere, is as a result of stigma. They think it's this way because of what this person has said, the attitude they got from the attitude from a family member. So these issues have affected them greatly. And so as a result of that, some persons find it difficult to come back for their refill, and they find it difficult to take their drugs because somebody has asked them. Also, the person must have even discussed, in the course of discussion, in one of their conversations, the person has talked so much negatively about persons living with HIV, not even knowing that his or her roommate is actually living with the virus. It reduces opportunity for work, school. That's the truth. Even social activities. I talk about trouble in finding houses. If you have encountered clients who have those difficulties, you will appreciate what I'm talking about. You will appreciate what I am talking about. Stigma results even in bullying, physical violence or harassment of persons who are living with HIV, depending on the community where they come from. Like I told you, there are interpretations from each community for persons living with HIV. They label them for various reasons. They believe it is as a result of maybe promiscuity. Even to some extent, some community believes that having HIV is like someone who has witchcraft. And so that is the way, it's like a revelation of an individual who has witchcraft. Because how can you have such a deadly illness, if not because you are a bad person? So we've had issues like that to deal with in the past. And so when our patients come, we want to engage with them. We want to understand what is going around in their lives. Remember, except you explore, you will not discover. So these are some of the effects that we can talk about. Like I said, it reduces self-esteem. And you know, an individual's self-esteem matters in everything the person does. It generates a strong use of, there's this feeling it generates among us, the effect of stigma. It generates a strong us and them phenomenon. So we want to be very, very careful. We've all talked about this, brings about social isolation, brings about lowering self-esteem, talks about mental health issues, non-adherence. We've even talked about a lot of things that are not on these slides. So what does HIV stigma look like? Remember, I told you that stigma and discrimination occurs at different levels. It could be in the health facility, in the school, in the workplace, in the community, in the house. And so what are we saying? The manifestation of HIV stigma varies from one level to the other. And then the manifestation too takes different forms, like I said. It includes isolation, ridicule, physical or verbal abuse, and even denial of services. Then we also need to understand that people experience stigma at different levels too. People could experience stigma by sex, by gender. It is believed in the course of our HIV program that women are more likely to be blamed for bringing HIV into the household than men. And so we also need to realize that HIV stigma actually reinforces existing stigma against marginalized groups. And that's why I told you compounded stigma. Some persons like people who are high risk, we consider high risk. And they said those words we are using too are stigmatizing. And so we need to find appropriate terms to use in describing people like that. Yes.
I think
and so
we have about
yes.
eight more minutes.
Okay, don't worry. We're going to talk about. So we want to talk about manifestation of stigma. Like I said, we said manifestation of stigma takes different forms. So in the health facility, what happens? How do we manifest stigma? We all know. So we can actually assess ourselves based on the discussions we've had about what stigma is, what discrimination is. We have seen that in the facility, some persons are denied appropriate level of care because they are living with the virus. You agree with me what I'm talking about? Where a patient needs to be attended to up to 4 or 5 times a day, but because the person is HIV positive, the healthcare worker is a bit careful, doesn't need to go too close. It's even your colleagues that will be telling you, I don't know what you are doing. You need to realize that that person is positive. You have what we talk about double gloving, labeling, segregation of patients, and those people at the end. That's for those who are actually dealing with patients on the ward. What of even for those of us who have one-on-one interaction with these patients at times? The way we discuss with them, the languages we use can be very, very stigmatizing. So we want to avoid problematic words and phrases when we discuss with our patients. We do not want to isolate them. We do not want to label them. And that's why we said in the facilities, don't label the facility the HIV clinic. That's stigmatizing on its own. It's not necessary. The way we interact with these patients when they come also shows stigma. We devalue them because we believe that we are giving them, they are at our mercy. They are not. Please, let's understand let's understand that. Our interaction with these individuals matters a lot. The stigma breeds from the way we provide services. And yet we are the best group of persons that is supposed to understand their situations. So we have selective use of universal precautions at times. You feel that this person is infected, and so I need to be very careful when dealing with this person. But because this person has a negative result, oh, no problem. You can take blood samples without using hand gloves because you believe that that individual is negative and you are safe. And that's why we talked about knowledge of HIV too. Not having accurate knowledge also breeds stigma. Because when you realize that somebody who is negative could be in the window period, you take the necessary measures you need to take. So when we talk about that's for health facility, is inexhaustible, the way we manifest stigma in those areas. Then for the home, you could see the diagram speaks it up, say it all. The color of plate is even different from the color of plate of the individual who is infected. Not apart from the fact that she's been isolated from other family members, even the plate she's using is different from others in the family. They are rejected, they are denied access, they are denied opportunities. Some persons initially, when the HIV program started, people were not sending people who had HIV to school. Children who were having HIV were not sent to school because they believed that they have nothing to contribute. Willingness to share food being seen as a disappointment to the family. So we have different manifestations of stigma and HIV in the family. So, but then there's something that we need to understand, that what you consider as stigma and discrimination for an individual might not be what the individual considers. So it's good to always engage with these patients and talk with them. For HIV stigma and discrimination is also displayed in the workplace, where people they are being labeled unkind gesture, people lack empathy, people lose their job as a result of knowing that they are HIV positive. We've had a lot of issues like that. People were laid off. There's this idea, there's this excuse they bring. They hide it under the fact that there's redundancy And so the first group of persons that will be laid off are those who are living with HIV. Some persons are denied promotion. And then in some cases, their colleagues refuse to work with them. I had a case of a school where some persons within the school facility realized that one of the staff was infected. Apart from the fact that they shared the information with parents, the other teachers are also finding it difficult to, relate or communicate with that individual. Then we have the worst of it all is the manifestation of stigma and discrimination by persons living with HIV themselves, which is a very serious aspect of stigma. Because once the individual loses that self-esteem, then it becomes very difficult for that individual to be able to go through successfully with care and treatment. They feel guilty. And we need to realize that internalized stigma is as a result of what they experience from the external. And so it is what you and I do. It is what we say, the way we behave, the way we act that makes the individual internalize this. And then once it's internalized, it now becomes an issue for this individual to deal with. They lose interest in everything, they reject. And that's why I tell clients, I tell my service provider, don't tell a client that if you don't take these drugs, you want to kill yourself. There are persons who want to die. And so you're giving them a leadway because they already lost self-esteem. They are living in guilt, self-guilt. There are some persons that will tell you that they've done so much, they've been so careful, they've taken all preventive measures, and so why did it get to this? So we need to be very careful in the way we deal with this patient. And so we need to help clients to understand that self-stigma is more destroying than every other form of stigma. But we also need to realize as service provider that external stigma is what breeds self-stigma. So then, what then do we need to do? We need to understand that there are strategies that should be directed towards that can help to reduce stigma at the individual, at the community, and institutional level. For the individual level, we need to learn to talk. We want to encourage clients living with HIV to talk openly about it. And then counseling is an integral part of strategies to reduce stigma. Remember that the aim of counseling is to what? Correct misconceptions, increase behavior change, decrease risky behaviors, and help people to take what? Make good decisions about their lives concerning in relation to HIV and AIDS. So counseling is very, very important for persons living with HIV. We also talk about the importance of creating supports and then linking them up to support services that are available. And that's why you see that in the course of treating people, in the course of initiating treatment, we want to ask people, who can be your treatment supporter? When you do that, you are trying to reduce the level of stigma and discrimination around that individual. Then for us as service provider, we want to focus on ourselves, and we fall under institutions. We're also a community. We want to be careful of what we say and the way we say it. And that's why I said initially, we need to avoid problematic words or phrase. We need to avoid using words that are stigmatizing itself. We want to change the word from risky behavior to risky factors. The issue of telling people when they catch HIV is not there. No, we don't use such words. So the things we say matters a lot. And then we need to also understand that we need to build skills around role play, skills building. The way we discuss with our clients, it's very, very important. Establishing or building their capacity to face the stigma that comes their way at any time. And that's why we talk about information-based approaches. Inform people well, let them know what their rights are. Let them know the things they need to know when it comes to issues of stigma, the appropriate places they need to report to, the legal action that can be taken to support them. We need to be able to link them up to appropriate organizations that can assist them face issues of stigma at any time. Then there's need to create awareness in the community at all levels.
Hello, Dr.
Educate
Yetunde.
people. Yeah.
Your time is up, ma. honestly. This we have 9 minutes to the end, and we need to take questions and.
Okay, so it's okay.
Yeah.
It's just that we needed to discuss certain things, but it's fine.
So you could just round up in the next 1 minute.
Okay, so I'm talking about the fact that there's need to redirect our approaches. The way we give information should be redirected. We need to create more awareness about HIV and AIDS at all levels. We need to break it down now. The way we need to talk about it at the primary level, the secondary level, and the tertiary levels. And so I'm sure those who propagate some of these laws would understand what we are talking about, because people need to understand it at every level and understand its implication at those levels. And then we need to build capacities of community-based organizations and even advocate for more legal and policy reform when it comes to HIV and AIDS stigma. Thank you.
Thank you very much, Dr. Yetunde.
Maybe I will share the slides with them.
Yes. Thank you very much. We just try as much as possible to maintain the 1 hour so that folks can go back to their clinic work. So you may want to stop sharing your screen. Before I open up the floor for questions, I already see Dr. Eddie Young Frank, your hand is up. I'd like to call on Dr. Bukola Adewumi. I don't know if you want to just say 1 or 2 things before, or you want to keep it when you're giving closing remark, but then the floor is open for you, Dr. Bukola.
Yes, thank you so much, Prosper. And I'm not a doctor.
Oh, sorry about that.
Yes, no, it's fine. So good morning, everyone. And like you said, I think I would like to just leave the floor for questions, and then I can speak during the closing remarks, because it's important that we ask questions.
All right, thank you
and
very
well
much.
done, Ma, for that presentation, Dr. Akani. That was great.
Thank you. So can we have Dr. Eddie Dong Frank? Your hand is up and you've been enabled to speak. Dr. Eddie Dong Frank, can we have your question, please?
Yes, thank you very much for this opportunity. Thank you very much, Dr. Yetunde, for your presentation. I learned that you're very correct about stigma starting from external and then internalization, and then how hard it could be for once someone has internalized stigma, how hard it could be now for the person to be helped. But I'm just curious, while you're talking about the whole stigmatization and discrimination thing, I remember how the whole stigma thing came out with HIV. I think it has to do with how the initial stages where people were just dying and all that. So people were just afraid. There were a lot of misconceptions around HIV. But I don't know.
Hello.
If we can change the approach between HIV with COVID-19. Can you hear me?
Yeah, I can hear you. We can hear you.
Okay. So if we compare the approach of HIV and the approach of COVID-19, we see 2 different approaches. During COVID-19, people who were infected actually came out, and we see all over social media, even presidents were coming out to say, yes, I contracted the virus, yes, I'm going to take the vaccine and all that. So it made people more comfortable to come out and talk about it, and stigmatization really wasn't a thing with COVID-19, because we could see people who came out and said, okay, this is what happened, and this is it. So what I feel, or what I should ask is it possible that we change the narrative with HIV? Because most people don't even know who is HIV positive, and we already know there's already an established fact that just because you're HIV positive doesn't mean that you transmit it to somebody else. So if there's a way to change the narrative for people to know, so that's just my question.
Thank you very much. Dr. Yetunde, can you take note of this? Let's just take these 2 more questions and that will be all. I have from Etimbok Aban. Etimbok Aban, can you unmute yourself and ask your question?
Okay, thank
please,
you very much.
1 minute, please.
Okay, thank you very much. I want to really appreciate Doc for that wonderful presentation. However, my concern is going towards the fact that we've been having series of rejection of PLHIV in some of the companies and some of the institutions, so even the federal institutions. Um, and you know, it worries from, and since we are reaching reducing or trying to eliminate discrimination in our environment, but come to think of it, it is eminent in some of the institutions and some of the private bodies, because some of these bodies don't employ people that are PLHIV. And it is worrisome because I wonder how we are going to achieve an environment free of HIV discrimination if this can be tackled. So I just don't know if we can, we can on our own fight and try to ensure that government bring up a policy that can truncate the companies or the federal institution from discriminating PLHI in terms of employment.
Thank you very much.
Thank you very much. Thank you very much.
Thank you very much, Etimbok, for that wonderful question. So, Etimbok, can you mute yourself now?
Okay, all right.
So we have I have GH Bonnie, General Hospital Bonnie, IHB Reverse Program. Can you please unmute yourself and ask? Please, let's do this in 30 seconds. Just go straight to the point. No need for recognition, please. Straightforward. Thank you.
Good morning, sir.
Good morning.
Okay, I wanted to ask this question that in terms of suggestion pertaining to self-stigmatization, because some of these community workers, they are not well, they just employ them, they are not well trained in the area of counseling. Because some of these our clients that we are having that is facing this self-stigmatization because it's the first person that's come in contact with them. So if the person did not counsel them very well, they will be experiencing this self-stigmatization because when they issue the drugs to them, when they go home, they will not have that knowledge of taking the drugs consistently each and every day when the time comes. So that is my own suggestion.
All right, thank you. Let's have Dr. Winifred Lagos.
I thought
Dr. Winifred Lagos. Dr. Winifred, please, in 30 seconds, then that will be all.
Yes, good morning. Yes, it's Wilfred. Thank you very much.
Sorry, Wilfred.
No problem. Now, just one thing that's fueling stigma for HIV. It's how it's transmitted. It's associated with sexual promiscuity.
That's it.
That is correct.
That's major thing.
So all the other means of transmission, blood transfusion, they probably doesn't recognize it. So that's one of the key things that are driving it and driving stigma as opposed to COVID. Thank you very much. That's my contribution.
Thank you very much, Dr. Yetunde. I don't know if you can use 30 seconds to respond to this.
Okay, so I will try as much as I can. You know, I like talking. I'm a counselor.
It is
so
well.
I want to start with the last speaker. I want to appreciate him greatly for that insight. And that's what I was going to talk about. You know, in the course of my presentation, I said that the initial information concerning HIV and AIDS, that's where we got it wrong. There was so much emphasis on sex as the major modes of transmission. And so that's what most persons held on. And that's why it's a bit challenging for us to actually get it right. So for me, it's a fundamental error. Let's be sincere about it. The modes of transmission was only, what was projected then was sex. And so that is what is on the mind of every individual. And so we need to change the narratives around that. We need to work hard on that. And that's why I talked about the issue of re-strategizing. And that's what the second speaker was talking about. It's good he gave, he was comparing HIV and AIDS, HIV and COVID, but the last speaker has helped us to see why it's a bit difficult. It will be very, very challenging. It's going to be difficult for you to hear an head of state come out and say that he has HIV. it's going to be quite difficult. And it's because of the associated stigma around it, because of the misconceptions and misinformation. And so one of the strategies that can also help us, I'm now bringing in the third speaker who talked about legal issues, about people losing their jobs, about people being laid off. These are issues that we face every day when our clients come to us. We are talking about, we could also think in this direction, establishing an HIV-related legal services that stands on its own. Like now, you've seen that they have, although we have acts against HIV/AIDS discrimination in the country, but then, you know, some of these things are just put into, it's just black and white. Implementation becomes very, very challenging. So, but if we have an established legal services that is only related, like what we have around gender-based violence, you see some states now domesticated gender-based, and then they have an area where is designated, a legal service program that is designated for just people who are facing those problems. So that's my own take on one of the steps we can take to help reduce stigma and discrimination when it comes to denial of certain opportunities and services. Then the last speaker talked about the fact that the counseling, the contact, the first contact these persons have with the service provider goes a long way to reduce issues of stigma when it comes to self. And then even for us as professionals, it can also help to reduce stigma. I want to agree with that last speaker that there are some persons who are providing services at the community level that do not have the basic knowledge they need to have when it comes to HIV and AIDS. And that's why we said we need to follow the information basic approach. Information goes a long way to change behavior when it is given in the right way, adequately, and in the right perspective. It helps people to understand what they go through. So if we actually look at all of this, we are all indicted. And so we need to do a lot. The government has their role to play. They need to learn to implement some of these policies. But let me now tell you something, Prosper, and everybody listening to the call too. At times you find out that even the patients or the clients who are being stigmatized and you want to take certain legal actions for them, they get withdrawn when it comes to the fact that it's like they will be exposing them. And that is still because of issue of stigma. They do not go for the legal aspect of whatever it is. They do not want to access legal services because they believe that they will be exposed. So it's a chain reaction, and we need to get it well. Once we don't get it well at the beginning, we need to nip it at the bud. Once we don't get it there, then it keeps moving into the other. And that's what we need to understand when it comes to the issue of stigma. Like I said, external stigma breeds internal stigma. External stigma is even easier to reduce, to break, but internal stigma becomes very, very difficult to take care of. So we need to do things around this.
All right, thank you very much. Dr. Yetunde, can you hear me?
Yes, I can hear you.
Thank you very much for your wonderful response and the presentation. I believe we have learned a lot about stigma and discrimination, which is very key in pursuit of our service provision to our clients. We have Bukola Adewumi. Bukola, I don't know if this is the right time for you to speak now. The floor is open.
Okay, great. Thank you so much, Dr. Akani. She has done a wonderful job in just educating us about stigma and discrimination. And I think what I would just add is stigma and discrimination is something that takes a while. It takes a long time. So in as much as we're all working towards ensuring that it's eradicated, it's reduced, I just want us to bear in mind that we shouldn't put too much pressure on ourselves in ensuring that. And just to also highlight some of the things that she has said, particularly in ensuring that we are informed. It's very, very important. If you do not know, it's better to ask than to make a mistake. So I know that we all come here all the time to have discussions around various topics, but I think it would be nice that if we're also confused or we do not know what to do, let's reach out to the appropriate people. You can always reach out to us here at CDC, and I know you can always reach out to people and colleagues also at the Federal Ministry of Health. So please, let's ask questions rather than make mistakes. So that's all I would say. So thank you so much, everyone, for joining this call, and we look forward to subsequent discussions and sessions where we would educate ourselves and remain informed. Thank you once again, and over.
Thank you very much, Dr. Bukola, for that. I will keep calling. Maybe you need to add PhD very soon so that the name can align. So thank you very much. Working with me, I have Dr. Nnaji Azuka, the WARE coordinator. And from all of us at Phase 3, we want to say thank you. The Federal Ministry of Health are unavoidably absent because they are having a high-level meeting and they are not able to join. So we look forward to seeing you again next week. We'll be looking at another interesting one by next week. The link that I usually share shortly after the ECHO session contains all the presentations we have had as far back as 2020 March till date. There's a lot of resources there, recording that has been archived, presentations and other guidelines that we have shared. So we encourage you to please explore those materials and use them accordingly. Thank you very much, and we look forward to see you again next week. From all of us here, I want to say bye for now.